Each year, approximately 50,000 Danish citizens die. Although many people find it unpleasant to consider how we will die, many have formed an idea about how the ideal way to die would be. To Annika Nielsen and her family, a fight against cancer has turned the end of life upside down.
I lost my grandmother 17 years ago, and my older sister died 2.5 years ago after contracting breast cancer. 3 months later, my mother was diagnosed with pancreatic cancer and died 8 months after that. During the last 10 days of her life, she was unable to help herself and needed constant attention. She was in a great deal of pain and kept saying, "Help me, I can't bear it."
A wish to end one's life raises the questions about euthanasia, a very sensitive topic with individual emotions and tempers at stake. Ethical considerations are relevant in this context.
They chose to end their lives the way they began them, together. Mark and Eddie Verbessem were born deaf and slowly going blind. Friends and neighbours said they were shocked, but understood why they decided they'd rather die than become unable to see or hear each other.
I think it is good. If you don't have anything else anymore in life, if you can't see, can't hear and can't speak, what else can you do?
The right for life is one of the basic rights humans gain and possess, and this is one right that serves as a basis for all rights. If there is such a thing as the right to live, then it must be followed that humans have the right to die on their own choice. But can humans truly choose when to end their lives? Today, dig deeper to the concept of death with experts from the fields of medicine, law, and religion. What is euthanasia? It literally means good death or a quiet and easy death. Euthanasia is often synonymous to the words mercy killing and assisted suicide, which is the act of permitting a terminally ill person to be killed with little pain. With this definition, there are 2 types of euthanasia. The first type is the active euthanasia, where deliberate intervention is done by using a medical device to cause a patient's death. The second type is the passive euthanasia, where the dying patient has the last say whether to end one's life or not, but physicians provide means to do it. Practicing euthanasia varies from one culture to another, depending on the circumstances whether it is done legally or not. Medical practitioners like Dr. Nicholas Newman, an orthopedic surgeon, is strongly against the practice of euthanasia and has shared his experience with patients suffering from broken bones and are in need of care.
What is surprising is how much these people want to live in spite of elderliness, old age, and multiple handicaps. These people, 99% of them, want to live. And these people show their desire to live. Very few exceptions, which I'll mention later. What is surprising, perhaps from people who hear a discussion about autonomy and liberty, one notes that so many of these patients, in fact almost all of them, are immediately willing to accept the treatment that I propose. Patients who have never met me, who have never seen me before, who don't know what I do, who don't know what orthopedic surgery is, patients accept what I, the treating physician, propose. Now, why is that? The reason is elderly people, ill patients, patients in distress, patients who are suffering, immediately turn to the doctor and they rely on the doctor to offer them the correct treatment, to offer them good treatment, to take care of them. I'm not saying that refusing my treatment is wrong, and that's not euthanasia either. Euthanasia is if I, in turn, to the patient who depends on me, if I in turn were to turn to that patient and say, I think there's nothing that can be done except euthanasia. Patients do not want this. Patients depend on me to offer them good treatment. But patients are really in a bind. And the more sick you are, the more you depend on your doctor. In fact, it's not to my credit that people accept what I suggest. It's because people who are elderly, people who are ill in various conditions of distress, they rely on the doctor. I have to be reliable as a doctor. So yes, indeed, I think it is terrible that we can kill our patients, and I'm grateful that we cannot.
Another point is from Professor Emeritus Mayer, where euthanasia would be unlawful if doctors did prescribe drugs which led to the patient's death.
The way things are now, if you're lying helpless in a hospital bed in unbearable pain, a doctor has the right to cease any medical treatment you're receiving, even if it leads to your death. They do not, however, have the right to deliberately administer drugs that will lead to your death.
Psychologist Dean P. Nelson notes that euthanasia can really be a choice by the patient.
I think a lot of people are frightened by the thought of what's going to happen, how an illness is going to affect them, frightened of death. What is death? Something that frightens most of us. I think the loss of control of the situation and the thought of what awaits is unnerving. I think the introduction of assisted suicide, giving people the chance to decide the timing of their own death, would give them a form of control over the situation. An overwhelming number of the patients I speak with think it would give them a feeling of control. Sometimes, if I get on very well with a patient, I ask, is it real control or just an illusion of control? This question always triggers a lengthy discussion. My own opinion is that it gives the illusion of control. When patients tell me that they wish to end their lives prematurely, I get the impression that it's a wish to escape from their discomfort rather than a real wish to die.
The most critical about this issue is the Roman Catholic Church. Father Chris Decker defines euthanasia as a justification for killing someone to lessen pain.
Now, sometimes euthanasia is an attempt to justify the act of killing someone as a means to eliminate suffering. But as a matter of morality, no matter the reason, the Church teaches that it is morally unacceptable. It constitutes a murderous act, and it's completely contrary to what we call the dignity of the human person, namely that a person is born with a dignity all their own. They are of inestimable value. You can't put a value on a human life because a person is indeed priceless because they are created by God. Euthanasia is also an act that denies respect of God the Creator. Even if a person is acting in good faith, nothing changes the nature of what euthanasia is. At the very base, it is an act of murder. Now, why does the Church teach that? Well, those whose lives have been diminished in any way or weakened by sickness, by illness, or by moving towards death deserve special respect because we are all of equal dignity as human persons. We should help them as Christians ourselves to live normal lives. That can be very difficult in the world in which we live today that pretty much says, well, you are what you do. Well, we don't believe that. We believe that we are who God has created us to be, and our value is not calculated by our worth in society, what we can produce. Who we are is more important than what we do. And so we are called to help that person live a normal life, even if they cannot do for themselves. Of course, if we are to practice euthanasia, it also means that we are denying the opportunity of what we call redemptive suffering, namely that it is possible for a person to unite their suffering with the suffering of our Lord Jesus Christ, who indeed suffered for us. It was His suffering, His death, and His resurrection that brought about our salvation. And we believe firmly that any time a person suffers, they can offer that suffering and unite it with Christ's suffering. And that has a redemptive value. It helps the person to grow in holiness. And likewise, we who are caring for those who are ill in any way or those who are dying can also unite our suffering to them as well. Redemptive suffering.
With all the points from the different views presented, up to what extent is euthanasia acceptable?